Okay, so finishing up with mood disorders here, we're going to talk now about suicide risk and assessment. And so suicide, killing yourself, taking your own life is obviously a consequence of depression. It can definitely be something related to both depression and to bipolar disorder as well. So if you look at this first chart here, this shows risk for suicide by age in the United States. And you can see here that the risk for suicide increases as one gets older. So reasons for this might be that, you've lost a number of significant individuals in your life. Maybe you feel like you're very alone. You're growing old by yourself. Might also be related to increased likelihood of experiencing physical health problems as you get older. This chart here breaks it down even more, looking at different ethnic groups and by gender. And so we see here that females have a lower risk of completing suicide compared to males, and particularly African American or Black women have the lowest likelihood, where white men have the highest likelihood, and particularly white men who are divorced, white men who are non-religious, most likely to commit suicide. For Black women, it seems that degree of religious affiliation, so being affiliated with some kind of religious group, is actually a strong protective factor. So that helps us to understand a little bit about why Black women, have the lowest risk of suicide. So in assessing suicide, you need to take into consideration that there are multiple different areas that are going to be important in trying to assess risk for suicide. And whenever you're doing an assessment of any kind, anytime an individual comes to you for any kind of psychological problem, whether it be depression, anxiety, eating disorders, it doesn't matter. You will always, always, always assess for risk of suicide as well. That will always be part of your assessment. So there are a number of different areas that you want to evaluate in doing a suicide assessment. You want to look at their history of psychiatric illnesses, particularly for individuals who have comorbid psychiatric illnesses. So this means individuals who have more than one diagnosis. This is higher risk. We know that affective disorders, so those mood disorders, depression, bipolar disorder, people who have alcohol, substance abuse problems, or schizophrenia, high likelihood of at least attempting, if not completing, suicide. We also want to know about your history. Have you tried this before? We want to know about your history. Have you tried this before? Is there a family history of this as well? We want to know also about you as a person. What kinds of coping skills do you have? Do you have a strong support system in place? How have you responded to these things in the past? Do you have personality traits such as impulsiveness that can increase the likelihood that you'll attempt suicide? Additionally, we want to know what's going on with you in the social environment. Do you have that support system? Do you have people around you who you can rely on? Do you have a religious background that will protect you? Additionally, we want to know, lastly, about symptoms that are related to suicide. So have you thought about completing suicide in the past? Do you have a plan? Have you expressed strong intentions? Do you have hopelessness? Areas to evaluate as well. Risk factors. Okay, so looking at the number of risk factors here, it should say that red are modifiable. Okay, so these are things that you can actually work with your client on. But particularly if you're male, if you're widowed, divorced, or single, it increases with age, and white men most likely. If you have unemployment, drop in socioeconomic status, access to firearms, lack of social support, psychiatric illnesses. If you have physical illnesses, this can increase your likelihood of completing suicide as well. Psychological dimensions, hopelessness, decreased self-esteem, behavioral, things like impulsivity, aggression, anxiety, panic attack. If you have problems with thinking, such as polarized thinking, this is that all or nothing thinking. Nothing is ever going to change. Things are always going to be terrible. I'm powerless to change things. Additionally, history of trauma in childhood, whether it be sexual or physical abuse, neglect, or loss of a parent. And then also those genetic and familial factors too, right? Have you attempted these things in the past? Do you have a family history? Other things that can protect you. So these are things that basically lower the likelihood that you will attempt suicide. So if you have children in the home, except if you have postpartum psychosis. So postpartum, this is for women after they have given birth. Some women experience severe depression following this. Women who are pregnant, less likely to attempt suicide. If your religious beliefs say that suicide is the ultimate, sin, the ultimate thing that, is never forgivable, that can be a protective factor as well. Satisfied with your life. If you have positive coping skills, so if you have ways of dealing with psychological pain that are constructive. So this can be things like physical exercise, maybe talking to your friends, getting that social support. And then also within the context of a therapeutic relationship, if you have a positive relationship with your mental health provider, you're less likely to attempt suicide. Talking about psychotherapy for suicide prevention. So regardless of the theoretical approach that you adopt as a clinician, the key element is to maintain this positive and sustaining therapeutic relationship with your client. And in working with your client, you want to make sure that you're targeting issues that are particularly important here. So you want to help your client recognize the particular symptoms that are related to likelihood of attempting suicide. You want to make your client aware. You don't want your client to be denying these symptoms. You want your client to gain some level of insight so that your client really knows what's going on and why these symptoms are so dangerous. And then you really want to work with your client on managing this dimension of hopelessness. So hopelessness very, very much related to attempting suicide. So you want to make sure that that's something that you target right away.